Well, good morning, everyone. It's a pleasure to be here. Introducing the Patient Journey 3 today, this morning to you, gives us the privilege of discussing with a group of highly recognized clinical and scientific experts to really go into the details when it comes to treatment planning and treatment execution for our patients today and going forward in the future.
The quality of life is often associated with the loss of teeth. However, we have to acknowledge that the quality of life cannot be assessed by how much money or how many teeth someone has. It is influenced by values and priorities which change throughout life.
So there are a number of anatomical considerations in the jaws and in the maxilla. These include the position of the floor of the nasal fossa, which constrains the vertical height of bone available.
And actually, isn't it amazing that in Nobel Clinician, we can simulate surgery and we can even make it look like we've completed the surgery because the software is so brilliant. But we can find bone in regions where we thought that previously we would have been obliged to use grafting techniques.
And what this study was able to demonstrate with the follow-up of 6 years was that the jawbone regenerated vertically with GBR techniques responded to implant placement with like native non-regenerated bone.
And fully dentally, short implant is an indication, and we have a very good literature by Bertil Freeberg, but maybe if you can use a bone to tilt a little bit your implant, have a better anchorage, could be a good, and zygoma implant is also a very good indication for dentists.
I think all of you would agree that one of the most difficult clinical situations that we have to deal with clinically is when we treat the posterior mandible that presents with limited bone volume.
So when we need to look at replacement of teeth, the first thing that comes to mind is good clinical judgment, which is first the clinical diagnosis, as well as the treatment planning of teeth in the posterior zone becomes the key indicator of clinical success.
If you happen to have any collaboration with the media team, please remember, when you invite them, you have to know that they don't pay you a visit, they will invade your clinic completely. And now, Johan and your team, please start, and eyes, please, and start this video.
It's my privilege to kick off Patient Journey 4, which addresses one of the most challenging and yet important aspects of oral implant rehabilitation, that of the management of the patient with a failing dentition.
Because you can't go to the literature and say, oh, here's an article that says that you're going to get a 97.8% success rate, and then you don't have any idea of how many implants you've done in your own practice. You have to know. You have to keep this information. You have to keep that data. You have to analyze it all the time.
Without raising a flap. We don't need it. Don't touch the tissue, and the tissue will grow around this well-polished surface.
We have, when we look at biological aspects, quite good parameters to say whether a tooth is safe, is hopeless, not worth to be maintained, or whether it is perhaps still questionable.
And with that, we're able to achieve what we had imagined. We're able to achieve a restoration with appropriate contours, emergence, and tissue surface.
A gingival papilla needs a bone papilla to hold the gingival papilla. And if you do not have teeth, there's a tendency for the maxilla to flat. And when you flat, your papilla will, instead of being a triangle shape, will be more like a round thing. And they tend to vanish with age.
This patient has no spatial awareness at all. When she bites down, she bites in a different position each time. And as well as that, there's no deceleration that is occurring before she comes into contact, resulting in very high peak impact forces against brittle materials.
It is reasonable to assert that most of us who have been in this field, as I suggested earlier, have been enthralled and provoked by what we have heard and seen over the past 3 days. And the reason for this, and I'm sure if PI were present here in more than spirit, but was sitting in the front row, he would be the first to agree that these clinical scientists, these colleagues of ours, have colored in amazing and exciting details in order to enrich our lives. We have all been very privileged to be part of a symposium that ultimately honors the brilliance of one man's journey from the edges of clinical science to the center of our patients and our own clinical lives. We thank you very much for making this possible. Thank you.
Most of all, I would like to thank you for being with us.